This is the posterior hip capsule stretch. The purpose of this is to open up some space on the downside hip to allow that femur room to glide and roll within the hip socket. To set up for this, we want to be in this side-lying position where we have whether a box or a bed or some sort of object where this leg can be resting on top, and then you can have this bottom side leg flush against the wall right there. It's really important that it stays flat the entire time. So he's in a straight line from his leg right here all the way up to the top shoulder right here. He's got a towel about an inch or two thick underneath his left side right here, starting at his waist, going up to right about nipple line right here. And then he's got a foam roller underneath the left knee right here, and a roller usually is best for this. We don't usually want anything else, but you could use a stack of books. That can work if you have nothing else to use. So Trevor, what I want you to do to set up for this is first, I want you to make sure that you're straight. So he's there, that's good. Now I want you to push your left heel into the wall, keeping everything flat. The whole foot is in contact with that box. And then I want you to tuck your hips, very good. Now, keeping all this in line, I want you to reach your right arm forward, not dropping really far forward, but keeping that in line. And now I want you to roll your right hip over your left, keeping yourself tucked while maintaining foot pressure of the heel into the wall there. He's going to feel a weird sort of bony sensation of a stretch in his bottom side left hip. That's the sensation we're going for, but it should not be painful. Please stop if you experience pain in this position. So what he's gonna do is just exhale all that air out into that position, and he's gonna feel these left obliques engage. That's great, nice soft 8-second-ish exhale, trying to get all that air out, and he's gonna feel his left obliques. Pause and inhale, he's gonna feel this stretch out right here on the top right side. All the while making sure that this leg is pretty straight and that left heel is in contact with the wall and this right hip is slightly rolling over the left. If you don't feel that stretch in your bottom side hip, then there is something you can do to help create that sensation. Some people don't have full hip extension on this back hip right here, so it's gonna be hard for them to keep it in line. You can come forward just a little bit more and then make sure that you don't roll that shoulder forward with it too much. And then do the same thing, tuck, roll the hip over, making sure you're keeping contact of that foot on the wall right there, or the box in this instance. The other thing that you can do is that you can adjust how close or far you are away from the wall. Some people benefit from scooting their hips a little bit closer to that box, and some people benefit from getting slightly further away. So generally speaking, you want to start with about a 60-degree bend at both the knee and the hip, but you can adjust as necessary. The way you can progress this activity to get a little bit more muscular recruitment to own this position is once you feel confident in your ability to maintain that hip capsule stretch, feel the left abs through the breathing and maintain this position, what you can try to do is keep that left heel and whole foot flat, but lift the left knee slightly off of the roller. If you can't do that, that's perfectly okay. But you're gonna have the intention to do that, and that's going to allow you to sense that left inner thigh. It's really important here that your hips don't roll back as you do this. You wanna stay still stacked over it. You should feel a good bit of left inner thigh, and that's it. If you feel any outside hip cramping, then you're probably not ready for that position quite yet, but just work your way into it over time. There's a couple of common mistakes we see in this activity. The first one would be rolling this shoulder too far forward, and now you're creating more rotation from the trunk than you are the hip. So make sure your shoulder stays in line with this hip and the rotation is coming from here rather than up here. The second thing we see is people lose this foot on the wall right here. So we want to make sure it's flush right here and the toes or the heel aren't lifting up. A lot of people roll forward and then this comes up. Make sure that heel's in contact with that box or whatever you're using here. If you lose the heel, you're probably going to lose that sensation of that hip capsule stretch as well. And the last thing we see is we have this knee bend excessively as this comes forward. And again, you're going to be sensing that roll from the knee, and that right hip's going to come forward because of the knee, and you're not going to get as much movement from here than you are here. And you're also not going to get as much dissociation between sides of the pelvis that we're looking for. So make sure that it's coming from this right here.